Welcome to RevMD podcast with me, your host, Dr. Debra Durst, and I have my co-host with me.
Hey guys, Farideh Golembiewski, nurse practitioner here at RevitalizeMD.
So at RevitalizeMD, we have a very active practice that is wellness and sexual wellness. And so we do a large amount of sexual wellness. We love it. There's obviously a gap in medicine when it relates to that. And so if you like topics of sex, that's frequently what we're talking about. And so if you do, and you like the content we're putting out, then please hit subscribe and help the channel so that we can reach more people. But this one's a good podcast because it's sex and death. Are they related? It's very simple.
Apparently, the answer to that is yes.
They are related. Maybe inversely so, right? And so, again, what is that relation? What do we mean by that? So we have frequently talked about the physiologic benefit of having sex because it is a cardiovascular workout, essentially, and it affects your hormones positively, and then it affects your mood and lowers your stress, all those positive benefits, physiologically.
Helps anxiety and depression and self-esteem. It builds intimacy within a relationship, but then, like you said, metabolically, it improves our blood pressure.
And does all the good things. So there's definitely a physiologic benefit. Are there studies that actually support that? And there's lots of studies. Yeah. And today, what we're going to look at is a study in 1997 that was done in Wales, right? That basically looked at a lot of men and women and over a 10-year period. And what they found was that there was a 50% lower mortality rate for an increase of 100 orgasms a year. And so that was over a 10-year period. It had almost 1,000 people. And again, I think most of the times when you're looking at studies related to sex, sexual wellness, men or women, they're going to be surveys. Because how else do you really look at that?
Yeah, or, polls, surveys, conversations.
Yeah, so it's a survey, of course, but a 10-year or over 10 years, an increase of 100 orgasms a year had a half mortality rate. So, and then
918 men in this study, which is over 10 years. That's a good retention of patients to study.
Answering questions in 1979 to 1983. And they looked at all deaths and deaths from cardiovascular disease. And so, again, a 50% lower mortality rate with a 36%. It was different. 50% is a number, but 36
compared to those with higher frequency versus lower frequency.
Yes.
So those that engaged and had more frequency of sex had a lower mortality rate.
A rate of 50%, yeah. And then for it was a 30% if you had an increase of 100 orgasms a year. And so a 36% reduction in it. But
so for those that engaged in sexual activity twice a week, they had half the death rate of those that only had sex once a month.
Yeah.
So think about that. Half the death rate twice a week versus once a month.
Yeah.
So are they related? Yes. More frequency in sex equaled lower death rate.
Yeah. So there are some studies that support that, and we will dive into some other ones. But this is just one we thought that would highlight the fact that there is some science that supports a increased frequency of sex. And of course, when you have that intimacy with a partner, that social connection, then that's helpful as well, and has lots of positive health benefits with it. And
they were looking at coronary heart disease in this one specifically, correct?
Yeah.
In this study?
Yeah, this was orgasms.
Yeah.
Orgasms matter. So facts.
They do.
Again,
okay.
Yeah.
And we did a podcast recently on the most Google questions regarding sex. And one of the things we talked about was, does sex matter in a relationship and the health benefits? So it kind of ties back to that again. So if you want to hear about the most Googled sex questions, listen to that podcast. But it kind of does relate back to this where, it is important. It is 50% more important.
Yes. So that is a fact. And so anyhow, definitely I think also just that fit in between a couple. And so if, that fit is there, if the drive is there, then the frequency is definitely supported by the science, and more orgasms equal lower death. And so related, yes. But anyhow, let us know if there's anything that you're thinking when that question is first posed of sex and death, are they related? And if you have any thoughts that you want to share on that, if you want to hear anything else, let us know what you want to deep dive into, because we're willing to talk about anything sexual wellness or wellness.